Do you remember Rwanda? They had a horrible genocide nearly 30 years ago. Would you believe that they are doing a better job managing COVID than Canada? A few weeks ago, a friend of mine who lives in Rwanda made a post that really got me thinking. Now, Rwanda is a country in Africa with a population of 12 million people, roughly the same as Ontario. It is also a very small country. You could fit 40 Rwandas into Ontario or 25 Rwandas into Saskatchewan. During the COVID-19 pandemic, Rwanda has seen about 25,000 cases compared to Ontario's case count of over 400,000. Rwanda, a country with a GDP per capita of only $820 US, has been far more successful than Canada in its response to this pandemic. And the reason why? Testing. Frequent and accessible testing is key to pandemic control. How can you contain a virus that you haven't detected? In Rwanda, they have made testing a part of everyday life. When in doubt, test. People walking down the street will be offered a test. Students, shoppers, travelers, everyone. A quick swab and some paperwork and you're on your way. To save money, they put about a dozen nasal samples into one testing vial, and if it's positive, then they test each one individually. Then they'll contact you that very day. Frequent accessible testing has allowed them to accurately trace and tackle the virus. Now compare that to Canada. How accessible are COVID tests? How frequently are you offered one? If you went to the drive-through test in Saskatoon, there are long lines to get to the test. You might have to wait for a few hours to be tested. How many people do you think skipped testing because it was out of the way or it took too long? Canada has large, developed, and well-funded health infrastructure, yet those systems were incredibly slow to react to the pandemic. Rwanda reacted with purpose and creativity. It goes to bad management. The Liberal government failed Canadians on many counts. They gave conflicting advice to the provinces. They didn't adopt a system of rapid testing. They focused instead on giving income supplements instead of testing for the disease. They shut down businesses, restaurants, and offices instead of efficiently testing, tracing, and containing. And most importantly, they have not been able to supply vaccines in a timely manner. As a result, Canada lags behind much of the world with less than 3% of our population fully vaccinated. In the US, nearly 30% of the population is fully vaccinated. Today, Rwanda has 6 people in ICU and only 1,300 active cases. Perhaps Mr. Trudeau should call up Rwanda and talk to their Department of Health. He might learn a thing or two.